Okay, awesome. So like Caroline mentioned, my name is Christina. In May, I will graduate, like she said, with my master's in counselor education. And so basically what that means is that in May, I will hopefully become a licensed counselor as long as I can pass all my exams. And I will work hopefully in a private practice that works with kids. So right now I'm working with kiddos who've experienced trauma or abuse. So mainly I work with anywhere from 3 to 4-year-olds to 18-year-olds who've experienced physical or sexual abuse. So it can get pretty difficult at times, but it's very important to talk about mental health and kind of have this discussion. So you can go ahead with the PowerPoint. Okay, awesome. So a little bit about me. My information's at the bottom, so if you have questions or email you want to email me, it's all there, so you can. You can go to the next one. So what we're going to talk about why having this discussion is important. It's not easy. It's always a little uncomfortable, but it's super important to have. How to react to teens who want to talk about their mental health or who are having mental health struggles. Signs or symptoms to look out for in teens who may be struggling. We're going to talk about asking the tough questions, how to talk to a teen who may be experiencing suicidal ideation, and then what to do if. So what to do if a teen you don't feel is safe to leave a life night because they might harm themselves, or what to do if they're experiencing some really difficult feelings and they're not experiencing any suicidal ideation. So maybe what's a plan that you can come up with them to better help them and their mental health. So why is this important? So approximately 1 in 5 teens aged 12 to 18 suffer from at least one mental health disorder. And so just to clarify, a mental health disorder is when it's diagnosed, severely impacts a person's daily functioning. So it's not just, oh, I'm sad today, so I have depression. It's something that severely impacts their functioning. So they can't get out of bed. Sometimes it comes to the point where they have, the back of their head, their hair is so tangled and knotted because they can't get up and they can't shower. Not enjoying the things they used to, not being able to do the things that they used to like to do. So it's a lot different from just feeling sad or maybe feeling a little stressed. So like I said, it can have an impact on daily life, overall well-being, as well as relationships, physical health, academic performance, and so much more. This was something that I thought was very important to highlight as well, that suicide was the second leading cause of death among individuals between the ages of 10 to 34. So one reason that I got into the counseling field was because I had a really close friend who died by suicide a couple of years ago. And so grieving her and then seeing what she went through for me helped me to want to, or kind of pushed me to want to help teens who may be experiencing that. We need to be prepared for a teen who's struggling with overwhelming feelings or thoughts of harming themselves, but we also need to be prepared for a teen who might come to you and say, hey, my friend Susie is really struggling with anxiety or depression, or is feeling like she might harm herself. What can I do to help? So this isn't just for teens who are feeling those feelings, but their friends probably are. One thing Caroline and I discussed when we had a phone call a couple weeks ago is having this conversation with a teen is not a matter of if, it's a matter of when. So a teen will come to you and express that they're having overwhelming feelings or is considering harming themselves. I was involved in a life teen group in high school, and my youth minister always told the story of it was her first day as the youth minister, and someone came up to her and said, my friend is in the corner and she is thinking about, going home and killing herself. So that was her first day on the job as a youth minister, and she had to go and talk to that teen about, what they were feeling and kind of walk them through that struggle they were going through. So it was her first day. So it's not a matter of if, it's a matter of when. You can go to the next one. So before we kind of dive in, there's some things that I wanted to kind of go over first. So there's a couple things. One, know your limits. And that is both that unless you are like a trained mental health clinician, that's not, that's not your job. Even I struggle sometimes with what to say, and that's what I'm studying. So know that it's not abnormal to not know what to say or to not know how to approach a situation. Talking about mental health, that's completely normal. But also know your limits in terms of you guys as youth ministers do so much and give so much to your teens. So know when you need to have some self-care and really kind of see what you need to do to recover from maybe difficult conversations. So the next point, what is the Catholic perspective on mental health? So sometimes in previous years I've heard, well, that some people say, just pray, and if your prayer life is better, then you won't have these feelings, and that's not what the church says. And that's not, that can be kind of harming to people who are experiencing mental health disorders. So I found this on, the National Catholic Partnership on Disabilities website. And there's the 4 legs of recovery. So biological, so mental health disorders are illnesses of the brain. So sometimes that involves, using medications. Sometimes it does not, but in my personal belief, medications are used after therapy is, considered along with therapy. So medication is not just like a Band-Aid to try to fix brain chemistries and all of that. It should be used along with counseling and other services. So psychological, that's that counseling, so understanding what mental health disorder they're kind of going through and all those parts. Social, having a supportive network for them to help them through those difficult times is vital. And then spiritual, so there's that prayer part, and that's super important, and we always have to bring our struggles to God, and he doesn't want us to ever be going through something difficult like a mental health disorder, so he wants to help us, but there's a lot more to it than just that. So that's kind of the Catholic perspective on it. And a teen should never feel like they can't communicate how they're feeling. So Caroline mentioned that I am I'm on the core team at St. Teresa's of Avila in Grovetown. And back in the fall, the youth minister there asked me to lead like 4 life nights on feelings. So it was if you go to the Life Teens page, you can search it. The Life Night series is called Mood. And I went through this with the teens, and we talked about how Jesus felt angry and how he felt sad and how he felt loved and how he felt joy. We talked about how he wants us to feel all those things, and all those feelings are good. We just have to know how to react in the best way. So I had that conversation with the teens at our church, and it went pretty well. One thing Caroline and I also talked about was mandated reporting. So in the state of Georgia, there are certain professionals who are bound by state law to report different things. So they're mandated to report if a child is experiencing any abuse. They're mandated to report if the child plans on harming themselves or if that person plans on harming anybody else. So youth ministers, church personnel are actually not mandated reporters. So you wouldn't have to, by law, report to DFACS or anything like that. So who is a mandated reporter? Physicians, anyone licensed to practice medicine. So some of you may have some of these titles. If you have if you're not the youth minister and you have another job, you might have these some of these titles. So you may be a mandated reporter. Hospital or medical personnel, dentists, licensed psychologists, podiatrists, registered or professional nurses, professional counselors, social workers, or marriage and family therapists, school teachers, school administrators, school counselors, child welfare agency personnel, child counseling personnel, law enforcement, and then reproductive health care facility or pregnancy resource care personnel. So that's right off of the Georgia Office of Child Advocacy website, and it lists who is a mandated reporter. So again, youth ministers unfortunately are not. So kind of want to bring this up before we get into this as well. There is a difference between a diagnosable mental disorder and then temporary feelings. So most of us probably in life have felt grief. So grief is different from depression. Like I mentioned earlier, anyone who's diagnosed with a mental health condition, it has to be impacting their daily living, and it has to be for a certain period of time. So I think sometimes it's maybe at least 30 days. So it really just kind of depends. So maybe your teen is experiencing stress over applying to college. That's different from a diagnosable anxiety disorder. We can go on to the next one. So what to look for in teens who may be struggling. So this is not an all-encompassing list. This is just some things that I pulled out of my textbooks and off the internet. So they might be experiencing one or two of these. They might be experiencing more, or maybe, you know, and this is more in people who have diagnosable conditions. So they're experiencing social withdrawal, so maybe not hanging out with the friends that they used to. Maybe they don't want to come to life nights anymore and see their friends. No interest in relationships, both making relationships and maintaining relationships. Irrational thinking or thoughts. So everyone hates me, no one likes me, whereas that is not the truth, and at all. Sleep difficulties. This can be both excessive sleep and a lack of sleep. We say in counseling, one of the most important questions to gauge how a client is asking them about their sleep. Are they getting not enough sleep, just a couple hours a night, or are they sleeping too much? Extreme mood swings, so easily frustrated, agitated, irritated, or easily provoked to anger, really easily provoked to any type of feeling that's very intense. Or they could have a flat affect. If they're normally a very bubbly person and they're outgoing, they could be very just flat, not have much emotion, not be that same person that they are. Feelings of hopelessness are very common. Difficulties concentrating, which leads to, of course, declining grades. Becoming easily fatigued, so lack of energy or motivation. That's a big one for anyone with depression, is that lack of energy or motivation. There's often physical symptoms in teens and children. So they'll say, my stomach hurts, I have a headache. And if you see this a lot, it's because kids and teens don't know, like, I'm experiencing anxiety, or I'm experiencing really maybe a bad depressive episode. So for them, it's just, I have a lot of tension, or I'm having really bad headache, things like that. Or a loss of interest in activities, hobbies that they would normally enjoy. So they normally really enjoy singing in the chorus, and all of a sudden they don't want to go anymore. They don't want to do it, where it was a big part of their life. That's something important to look out for. Really, the important part is to know how the teens normally are, and if there's a big change in that. And if you kind of see them going back to where they were, that could have been like a temporary state of those feelings. But if you see it kind of long term, then that could be something more. And go on to the next one. So how to react when a teen brings up mental health struggles. I'd say the most important thing is just to provide a space for like an open space, and a non-judgmental space. So, but don't be afraid to ask the tough questions. We're going to get into that a little bit more, but don't be afraid to ask them, have you ever considered harming yourself? And we'll talk about why that's so important in a minute. When you're asking questions, asking open-ended questions. So what, when, where, how. One thing that maybe you've not heard before, I know I've learned it multiple times in my training, is try not to ask why questions. Why are you feeling this way? In a way, why can come off judgmental. We never want a teen to feel that way. And it's not so much, it's really just the word why. It implies that I don't understand what you're feeling, so tell me. And all the questions that we're going to talk about later, those tough questions, none of them are asked in a why format, so you can kind of see what they look like. Listening carefully. So listening is different than hearing. So listen carefully to what they're talking about and what they're going through, and see the best way to help them. And of course, know your limits. So talking to the teen's parents, including them, that's very important. referring to a counselor, and then making a plan. Those are all kind of important steps of where to go next. I know I've been in a situation before where we were talking to a teen and that teen said, I'll tell my parents what's going on. So we kind of trusted that teen to go and tell their parents what was going on, and they did. But if you don't think that that teen could do that, you could always sit down with the parent and the teen and have that conversation with them. But always make sure to include the parents, because they're the parents and nothing can happen without their approval and their guidance. But also, advocating on what's best for that child. And go to the next slide. So this is a quote I wanted to go over before we walked into the tough questions. So the quote is, it comes from one of my textbooks. It says, asking about suicidal ideation and intent does not increase the likelihood of someone thinking about suicide for the first time or engaging in such behaviors. In fact, most clients report a sense of relief and support when a caring, concerned, and non-judgmental person expresses interest in their mental wellness or mental status. So I know sometimes that can be the idea of like, I don't want to ask because if I ask about it, that they're going to get the idea in their head if they already didn't have it. That's not the case. Asking about it in a caring way, which if you're here, I'm going to say you have a really big heart and you care about your teens. All youth ministers I met have the biggest hearts in the world. So you care about your teens and you want what's best for them. So just asking and checking in with them is going to make them feel more loved and more willing to open up and talk about what's going on with them. And go to the next slide. So questions to ask. So there's two ideas when it comes to if a teen is experiencing suicidal ideation. So there's ideation and then there's intent. So ideation is the explicit expression of the desire to die or take one's life, whereas intent is the desire or wish to die. So they sound very similar, but we're going to kind of break it down into why they're different and why they're both important to understand when talking to teens who you suspect may be having suicidal ideation. So again, like I mentioned in some of the previous slides, none of these will be why questions. They'll all be, so there's haves, there's what's, there's all kinds of questions here, but not whys. So the first part, the ideation. If you ask a teen, have you ever wished you were dead and could not wake up? And they say, well, yes. Have you had thoughts of hurting yourself? They say maybe yes or no. This kind of works like a progression. So if they say yes to one, move on to the next one. If they say no, just kind of feel it out and see if they're being, truthful, because talking about these feelings is not easy. And kind of feel it out and then see where to go from there. So you would ask the ideation questions first. Have you wished you were dead or could not, wake up? Have you had thoughts of hurting yourself? Have you had thoughts about killing yourself? Two different things there. Hurting yourself and killing yourself are two different things. So if they say no to those, then you feel pretty confident that they don't have any suicidal ideation. You really don't have to move on to the intent questions, because the intent questions will kind of gauge where that teen is or that person is in their feelings, in their suicidal ideation thoughts. So the next questions, have you been thinking about how you might hurt yourself? This is asking, have you thought about a plan? Have you had these thoughts and had the intention of acting upon them? Because sometimes, teens will have these thoughts, but say, but I would never act on them. I feel those things sometimes, but, I'm able to kind of push it away and I would never act on it. Have you started to work out or have you already worked out a plan or details on how to kill yourself? So that's kind of, again, asking them, do you have a plan? Have you thought about how you would do this? And then again, do you intend to carry out this plan? That's important to ask. The next one, have you ever done anything, started to do anything, or prepared to do anything to end your life? This could be finding pills in the medicine cabinet, finding a knife, giving things away. With my friend, she recorded audio tapes to people in her life. So doing things like that, saying goodbye. Have you already started to prepare for if you would take your own life? Those are important questions. These are not easy questions. They are really uncomfortable. But it's important to ask them to best understand where that teen is in their current mental state. If you ask the teen those questions and they say yes, the right side now is going to kind of give you more information. So how many times have you thought these thoughts? Is it once a day? Is it once a week? Is it once a month? Maybe it's when something difficult happens, maybe they have a test coming up, or maybe they lost somebody in their life. You have to kind of see when these feelings are coming up for them. Duration. How long have they had these thoughts? If they tell you, it's been going on for a week, or you can kind of gauge if anything has set them into, like, kind of started these feelings for them. Maybe they've lost a parent or a friend or someone like that, and they're going through grief. Or maybe they do have a diagnosable mental health condition like depression. Controllability. Could you or can you stop thinking about harming or killing yourself if you want to? These thoughts are often intrusive, and for people with suicidal ideation, it is very difficult to control those thoughts. It's almost like they're just overwhelming, and that's all they can think about, is that the world would be better off without them, and that the people in their life would be relieved if they didn't have to worry about them anymore. And then reasons for the ideation. This could be a part where you fall into that why, like, why are you feeling this way? But notice that it's reworded and it's kind of asked in a different way. So what's, sort of things are going on that have, that make you kind of feel this way, that make you want to hurt or kill yourself? And so kind of further, was it to end the pain or stop the way you're feeling? Both, something else? Just kind of gauging what's going on and why they're feeling the way they are. Like I said, for some teens who die by suicide, it's that they felt like they were a burden to the people around them. Or some, they just wanted to stop what they were experiencing. They didn't know there was another way out. So asking these questions is super difficult, but it's very important. One thing that helps me in asking these questions when I have clients who maybe disclose that they're having suicidal ideations, I practice these in the mirror. So I practice having these conversations because they're not easy. So I practice, asking, have you wished that you were dead or wished that you could go to sleep and not wake up? And then I say, okay, well, what if they say yes? Then what would I say? These are conversations we're all either going to have or you've already had them before. But it's, I'd say practice is the best way to kind of get ready for those tough conversations if you haven't had them yet. We can go to the next one. So this is so from here, I'm going to break it down into kind of two parts. So what to do if you think the teen is safe to leave, if you do not think the teen is safe to leave for fear of harming themselves. So if they say, like, I think this every day, all the time, I just want to harm myself. I have a plan, I have the means, and I have the gun at home, I have the pills at home, I have the means to do this, or I'm going to wreck my car on the way home. So you don't think they're safe to leave. So what can you do in that moment? Or what can you do if you think they're safe to leave and they're not in danger of harming themselves? And then like, what kind of plan can you put in place? So I'd say the first thing to do, if you do not think the teen is safe to leave and they're at like a life night or you're on a retreat together, I'd say the first thing is call their parents. The parents need to be involved every step of the way. I'd say this for both of them. Parents are going to be so helpful in helping their child because they can help their child get the counseling resources. They can help their child get to those counseling appointments. They can do all these things that us or you guys as the youth ministers, we can't necessarily do. We can just be there for that teen in that time and what they're feeling. So most important is call the parents and talk to them and tell them what's going on. Especially with teens, it's important to tell them, I really appreciate you coming to me, and I know that was difficult, but here's what we have to do now. What I'm going to do is I'm going to call your parents, and I'm going to tell them what's going on, and then we're going to figure out, all of us together are going to figure out our next steps, because I just can't let you leave here because of the feelings you're having. Let them know what's going on. They're teenagers, they're aware. I'll say a lot of times teens tell somebody because they want help. They know what they're doing. They know that you have to call their parents and tell their parents what's going on. And a lot of times they just can't bring themselves to tell their parents about these big feelings that they're having. And so you could be the way that they do that without actually having to directly tell them. So number one, call parents. Kind of let them go from there, but talk to them about different resources. I know the youth minister at our church, Ashley, she has like a list of counselors that are in the area that say that they work in a Christian and like Catholic like the theoretical perspective. So she has that list of counselors in our area. So she gives that to them. So it's important to kind of maybe look at those resources and see what you have in your area. So if you do have a teen and then the parents come in, you have those. So what to do if the teen is safe to leave and not in danger of harming themselves? So that could be as simple as coming up with a plan, coming up with okay, what do you do when you feel these feelings? What can you do that can help you get through them? Who can you call that can help you through them? And that's what we're going to go over in the next couple slides. I have 3 different examples of like a safety plan or a crisis plan, kind of however you want to call it, coping plan, that I sent to Caroline so she can send them to you guys. She also has this PowerPoint, so she can send this to you as well, which has all the questions and all the information. So we can go to the next slide. This is the first example of a safety plan. So you can see warning signs of a crisis. So for them, each person is different. So their warning signs are going to be different. We all experience anxiety different, but it's interesting to ask someone how they experience it. So physically, their chest might get, their heart might start beating really fast, and maybe their ears turn red, maybe their face turns red. Everyone is different. So what is the warning sign for that person, that teen? Step 2, activities that they can do by themselves to try to take their mind off of things. If you Google grounding exercises, you're going to find a whole list of things that can bring the person who's experiencing maybe anxiety or depression back to kind of reality, because anxiety, those big feelings often take the person away from the current space and bring them to the what if space. So bringing them back in. So that could be as simple as, tell me 5 things you see right now. Tell me 4 things you can touch right now. Tell me 3 things you can hear right now. Tell me, going through maybe the senses and having them do things like that. Or you give them an item. I just picked up this off my desk. It's a little headphone holder, and put it in their hand and say, okay, squeeze it really hard. Squeeze it. Tell me what you feel. And then having them just bring them back to this moment. So there's a couple of different exercises that they can do to help themselves. Or maybe it's deep breathing, just breathing in and breathing out. So step 3, taking their mind off of things. So people they can call, mom, dad, always important people. Maybe it's an aunt, an uncle, a cousin, a best friend, a significant other, whoever it is. It's important that they kind of put those people on there. And it says places I can go. So go to mom and dad's house, go to church, go to places that maybe can help them calm down. Step 4, people they can call for help. So those people that they can call, it might be the same people that they can go to in a state of crisis, but those people are important. Step 5, ways that supportive people can help me stay safe. That could be as simple as just someone telling me they love me, someone telling me they're there for me, or it could be, checking in with me daily to make sure that, I check in with my feelings and they check in with my feelings. It could be whatever it is to that person. And that's why it's, very blank as it is, because it really is completely up to the person who's experiencing those feelings. I can call these very important phone numbers. So that could be, there's a Georgia Crisis and Access line. That one could be on there. There could be a number for maybe the youth minister on there. Different numbers of people who are above their personal relationships who could offer extra support. So crisis counselors, things like that. And then have them end with their strengths. It's always important to highlight strengths in somebody. So maybe they're very caring, or they're driven, they're compassionate. Have them say what their strengths are. If they're experiencing, really intense feelings of depression or anxiety, might be difficult for them, so you can help them out. But having them look through those things is important. Go to the next one. So this is another example. So this one's a little bit different. Like I said, just providing y'all with some different examples of what they look like. I just Googled safety plan, coping plan on the internet, and these all popped up. I'll say Pinterest is one of my go-to things for counseling resources as well. So step one, know when to find help. So again, what are those warning signs? Maybe that's thoughts, moods, images, behaviors, anything that they're feeling that's going to help them identify that they're maybe getting into a not so great place. Coping skills, what can they do to help? Maybe they need to go sit down and read a book. Maybe they need to curl with a blanket and just relax, so whatever it is for them. Again, the people and the numbers, and then at the bottom it has so a space for your local emergency number, local professional or agency, and then suicide hotlines in the United States. Go to the next one. So this is another one. It's kind of a more fun way to do it. So personal crisis plan. So I know I'm triggered when. Some good ways to distract myself are safe people I can reach out to, coping skills I can use, ways to keep myself and my space safe, and then other resources like at the bottom of the other ones of professionals who can help in the area. Again, I Googled and found a lot of these, so you can too. And you can always make it your own too. So you can put maybe favorite scripture verse that helps me get through a bad day. Anything that can help them in a bad, in a difficult moment would be great if you wanted to create your own kind of safety plan. But again, I pulled these off the internet. You can go to the next one. This is one of the things that I wanted to talk about as well. So when it comes to, kind of like I mentioned earlier, youth ministers, really anybody who's in the helping kind of field and is giving their all the time, self-care is very important. So one of my favorite quotes that's written on the bulletin board in my office is, you can't give from an empty cup. You have to make sure that you're filling your cup and that you are doing the things that feed you and feed your soul so that you can best help your teens as well. Burnout is a very real thing. I hear about it like every class period of every day. Professors usually ask us, what are you doing to help combat burnout? What are you doing to take care of yourself this week? So maybe ask yourself that and see where you are and see if you're doing things that are going to help you with burnout. I know one thing for me is when I come home, I try to leave work and clients and school and all that at those places. So I try to just come home and relax and not worry about anything else. That can be difficult sometimes, but I try the best I can. So whatever it is for you, maybe it's taking a bath, once or twice a week just to relax. Maybe it's spending time in prayer and spending time, in scripture. Anything that is going to feed your soul and help you with, feelings of burnout, because with the professions that we do, we're giving our all constantly. And so it's important to take care of ourselves. You can go to the next one. So again, there's my information. So I wanted to provide a lot of time for questions, anything I can help with. Again, I'm not yet a professional, but I want to help as best as I can. And so if I do know the answer, I will answer your question. And if I don't, I will look it up and I will try to get back to you as best as I can. So does anyone have questions, comments, concerns, anything?